Chairman Pomeroy and McDermott, ranking members Johnson and Linder, and members of the subcommittees, thank you very much for inviting me to testify today on behalf of the CCD Social Security Task Force. As the claims backlog has grown in recent years, it has been very troubling to watch the lives of claimants unravel while waiting for decisions. Homes are lost, health deteriorates, and some die. Families are torn apart. Once stable financial security crumbles. While Social Security has made slow but steady progress reducing the hearings level backlog, the news at the initial levels is less positive. The recession has led to an unexpected surge of new disability claims, resulting in increased processing times. We are very concerned that SSA's plan to eliminate the hearing level backlog by 2013 is at risk as the wave of new claims is appealed. There is reason for optimism currently at the hearing level. Due to congressional appropriations and the hard work of ALJs and hearing office staff, there's been slow but steady progress in key areas at the hearing level: pending cases, processing times, and age of pending cases. This improvement, however, is fragile. The number of new hearing requests has increased significantly this year. While processing times at the hearing level have decreased, the improvement is not uniform across the country. There is significant variation, but last month the majority of hearing offices had average processing times above the national average of 437 days. We are deeply troubled about trends at the DDS levels, where we see an increase both in processing times and in the number of pending cases. One area of ongoing concern has been the reconsideration level. Recon allowance rates are generally very low and are viewed as a rubber stamp level that must be endured before a claimant moves along to the ALJ hearing level. The President's fiscal year 2011 budget request would reinstate the recon step in the 10 prototype states starting in Michigan. In these 10 states, for the past 10 years, recon has been eliminated, and claimants' representatives in those 10 states report that the process has worked well without recon. They do not believe that reinstating recon will benefit their clients. My written testimony includes comments from representatives in most of the 10 prototype states, which describe in no uncertain terms their opposition to reinstating recon. I'll just read one quickly, an excerpt from an attorney in Michigan. Bringing reconsideration back to Michigan would be an absolute tragedy, adding more time to the decision-making process. For many years, the CCD task force has been on record supporting both the elimination of the recon level and providing more time and effort to better develop disability claims at the initial level. The 10 prototype states began to pilot the elimination of recon in October 2000. In January 2001, SSA published proposed regs to eliminate recon nationwide. Let's keep going.
Keep going.
Okay.
We're used to buzzers around here.
All righty.
And this vote is going to go on for a while. I think we'll be able to get everybody's testimony in.
Thank you very much. In 2001, SSA published proposed regs to eliminate recon nationwide based on the preliminary results from the prototype states, which showed that claims were awarded earlier in the process, that accuracy was comparable to non-prototype states, and that denied claims moved to the hearing level sooner. However, just a few months after the proposed rule was issued, SSA announced that the national rollout would be deferred because of increased program costs due to the fact that there was a higher allowance rate at the initial level in the prototype states. It's a sad commentary that Social Security made this decision, that it's better to deny claimants and require appeals, which might lead to the payment of benefits to which claimants are entitled. The system should not deliberately construct barriers to legitimate receipt of benefits. In sum, and echoing many of the speakers earlier today, unless the DDS levels can provide a more meaningful evaluation of disability claims based on a complete record, we question whether reinstating the recon level in the 10 prototype states will truly benefit claimants or if it will just add another barrier. My written statement describes our support for many of the Commissioner's initiatives to reduce the disability backlogs, including online access and other technological improvements, the Senior Attorney Program, and new screening initiatives. The CCD task force also supports initiatives to improve the front end of the process, as this benefits both claimants and the agency by making correct decisions at the earliest point and avoiding unnecessary appeals. My written statement includes a number of recommendations focusing on the proper development of the claim at the beginning of the process. Finally, I would like to thank the subcommittees for their efforts in obtaining adequate funding for SSA. We are grateful for recent congressional efforts to provide SSA with sufficient funding that has undoubtedly led to SSA's ability to make progress with the hearing level backlog. If SSA is to address its unprecedented increase in workloads and prevent a severe disruption in service delivery, we urge support for the full appropriation requested by the President for SSA's administrative funding in fiscal year 2011. Thank you, and I'd be happy to answer any questions you may have.